Hello, everyone. It's Dr. Jay Bowen from New Jersey Regenerative Institute. Welcome back. And if you've been following us on social media, you know that here now I have a very special guest, Dr. Ron Dellanno, who's a chiropractor here in New Jersey, and he invented a nice little device that we're going to talk about because of this sort of newer thing that's been around for a long time called forward head posture. And he introduced me probably about 2 decades ago to the term text neck, which I thought he was joking with. And he told me to Google it, and I found that it was actually a real thing. But medically, we call it forward head posture. And you'll probably see, depending on how old you are, you're either one of the kids walking around and walking into traffic, or a parent where you're trying to get your kid to stop like this all day on their computer or iPad from the school. So unfortunately, we're moving down this bad pathway of bad ergonomics. So I thought it'd be a great idea to talk to Dr. Dellanno and sort of get a little bit of ideas about what this product is and how it came to be. So Ron, if you would just introduce yourself to the audience and tell us a little bit about your background.
Hi, I'm Dr. Ron Dellanno. Thanks for that introduction, Dr. Bowen. I've been working in the area of spinal rehabilitation for probably a good amount of 30, 35 years, working on technologies, patented technologies, into applications for not only doctors, for patients. We have a safety seat we designed for the military that will withstand IED blasts. So we've been spending a lot of years developing technologies around the concept of protecting the spinal alignment, particularly the spinal curves. Now, with the subject matter that we're talking about today, forward head posture, it is a problem throughout the world. Every nation has it. The highest risk factor for having forward head posture is the fact that you own a cell phone. And that's the beginning of the electronic indoctrination of pitching your head forward. And that's having several negative consequences on the rest of the spine. So when the head goes forward, the cervical spine or the neck, which has a normal forward arc to it, gets straightened. And that causes several problems in the body. It causes a pressure on the joints itself in the middle of the neck. And when that happens, that pressure starts straining all the ligaments. This is happening very early in life. This is a subject that we used to hold for people in their 20s, 30s, 50s, 60s, but now we're seeing in children because they're all glued to these electronic devices. It seems like a lot of kids don't even talk to each other anymore, they text. So if it's become another medium by which to communicate, that is really not in our best interest. So parents out there and all the young people watching this, you ought to give this some thought because it is causing several physical maladies inside your body. Now, going back to the straight neck, many of you are already starting to get strain in your neck, and that causes neck pain. Now, as that neck pain builds over time, months and years, it starts to deteriorate the joints inside the neck. And then when you're in your late teens or 20s, you may actually have some early disc pathology, meaning that the discs in your neck are suffering some injury. They're either bulging or they're starting to get diminished, or even the vertebrae start to change their shape because of the awkward position of the neck being put into that straight alignment as a result of you looking down at your phones. Now, what else happens? Well, we now know from the research that this head posture, as it goes forward, it elongates the spinal cord. So inside your neck, there's a spinal cord and there's a centerpiece called the cerebral spinal fluid. So that is in a little canal. So as that neck straightens out, it actually elongates, kind of like a slinky. You're just extending it up to about 3 inches. Now, this causes a narrowing of the cerebral spinal fluid canal in the middle of your neck. It also causes a pinching of the vertebral artery in your neck that feeds your brain. So these are not good things. So what are some of the symptoms that you see from this so we can make this very real for you? Well, the obvious symptom is neck pain, shoulder pain, ache between your shoulder blade. Now, I'm going to bet a lot of your audience, Dr. Bowen, right now is seeing the picture in their own bodies and spines. But beyond that, there's headaches. There's could be balance issues as well. Balance, equilibrium. You can actually feel tingling in your hands and fingertips. And some patients actually have problems with gripping things. So in the medical field, we call that interference in the sensory and motor cortex in the brain. Those nerves go from the brain through the spinal cord, and in this case, out to your arms, hands, and fingertips. So all this collage of symptoms is a direct result of chronic forward head posture. Now, we doctors always remind our patients about posture, and unfortunately, the pervasive use of these electronic devices is not, it causes us to be in that forward head posture for such a prolonged period of time. You look back on your phones every week and they tell you you're spending 5 hours, 6 hours, 7 hours a day looking down electronic devices. So that really adds up. And the only way we could think of that we could help the patients on a national and on an international basis was to devise a technology that could be worn as a countermeasure for these folks who are suffering from this condition, which seems to be about everybody. So the countermeasure is very simple. We'll be showing you some pictures in a few minutes of the Cervigard technology. So it's designed to protect the neck curve and to keep the head back over the shoulders, and it's worn for 15 to 20 minutes a day. And that's a very small amount of time, and the benefit is so dramatic that it helps neutralize the effects of the forward head posture on the many hours we're looking down at the devices. So I think let's go to some questions you might have, Dr. Bowen, that I could be even more precise.
Yeah, so it's very interesting. You laid out the problem in some good detail. I was going to ask you where the idea came from, but it's probably because, like a lot of things in technology and medicine is that we're limited. The patients are still having symptoms, so we need to come up with new ideas. And then you forgot that probably the most important thing. It's not just the advent of the phone, but it's because we don't have our grandmothers hitting us on the back of the head telling us to sit up straight. And then unfortunately, we're a little older, but you said this thing called a slinky. We wouldn't have to throw up some kind of picture for these younger people. They might not know what a slinky is.
Oh my
So,
God. A
so
spring
yeah,
that gets,
if you can go a little more detail about sort of where that idea of the Cervigard came from, and then you alluded to it, but let's talk about what the ideal patient is.
okay. All right, so where did it come from? Well, as a researcher and a doctor, and you know yourself, we've worked many years to build a neck curve in patients because we know that patients with straight necks, as a result of this forward head posture, are 18 times more likely to have neck pain. So we spend a good deal of our time learning to build the curve of the neck. We put rolls behind people's necks. We put pumps behind the necks. We've done a lot of things to build the neck curve, but it would never last. And when we finally figured out the last piece of the mystery, which was the position of the head, your spine does not like a head that's forward and out of position. So once we were able to build the neck curve and simultaneously correct the head posture, in this case, the forward head posture, the dramatic results shot off the charts. We saw a dramatic improvement in all the patients, and we knew we had a winner. We just had to make a technology that could be applied in the home, and that's what we have now. The Cervigard technology will not only fix your forward head posture, but will gently fix the neck curve in your neck while you're wearing the collar. It does both activities at the same time.
So we'll show a little picture of the device, and it looks a little intimidating. So I was there for a little bit of the beginning of it when you had it. And so talk a little bit about why it looks so crazy, right? Because you initially have these neck collars where you can just put people in it, but they don't actually correct the curve. They're just
Right,
stabilizing post-operatively. And then you
right.
start pushing on the jaw, but then you get TMJ. So go a little bit more into why this thing looks a little
All right,
intimidating.
all right. I have a Cervigard in front of us here. It does look a little odd because it's a device you've never seen before, but we have to bring the head back over the shoulders. Now, we can't push on the jaw because you would get jaw problems. We can't push on the top of the head because it would cause the head to extend. And what we need to do is translate the head directly rearward. So the best spot for that is right on either side of the nose. So this is the Cervigard device, and these are the two cheek pads on either side. The nose would be right in the center. We're going to show you some pictures of that in a few minutes. So, and then on the side of the collar, there's adjustments for how big the face is, but these dials here will rotate and bring the cheek pads, pushing the head back over the shoulders. So there's one on both sides. You can hear it click as you move it. And its job is to then move this way and line the head back over the shoulder. So I think we're best served if we show some pictures of that at this time. And then the person, when it's back there, we ask you to sit back, let the collar push the head back over the shoulders. And in 15 to 20 minutes, it's amazing how much better your neck's going to feel when you take the collar off. You'll feel things like pressure on the cheeks because it's pushing your head back over your shoulders. It has to push hard enough to get the head backward. So in the first days and weeks that you use it, you might feel a little extra pressure on each cheek. That's totally normal. And then also at the end of the 15, 20 minutes, you might feel some achiness in the bottom of the neck. Well, that's a good thing. It means that the head is realigning over the shoulders, ears over shoulders. That's the concept. And then the muscles and ligaments will start remolding to be in the proper position. Much like when your dentist puts braces on your teeth, they put the braces on to realign the teeth within the bone of the jaw. And that takes, of course, a couple of years' time. Thank God the Cervigard alignment of the head over the neck doesn't take anywhere near that. You only have to wear it for 15 to 20 minutes a day. And over a course of 6 weeks, most patients with typical issues with the neck will be resolved. Older patients, which we're going to talk about in a part 2, require a lot more help because they have arthritis and disc problems. But these folks are also going to get dramatic benefits from these and feeling a lot better. But there's a few extra considerations that you have to go through with your doctor to get that working properly.
And I think a good point just to put out from my patients' experiences is that sometimes they don't tell you the whole story. And so they end up thinking the goal is to take that track and go all the way back. And
Yeah.
like it hurts. I'm like, well, you went too much too fast. But the goal, like you said, get the center of that ear over the center of that shoulder. And that may, for different neck sizes, maybe you only get the 3 notches to the back of the track, or maybe you do go all the way back. But it's not a race, right? We'll get there at some point. The other thing that's really interesting I show people is that, you said you put it on and you sort of lay back and your spine is somewhat, relaxed. So you have that low back curve. Well, a lot of my patients sit with bad posture in a bad seat like a couch, and then they're jamming forward on this thing and they're going, this whole thing hurts. And I'm like, well, if you sit up straight with your low back, all of a sudden everything falls in place from the foundation upwards. And then they come back, oh, that's so much more comfortable. So if anybody does get this and wears it and they have some issues, just talk to the person who gave it to you. Make sure you're doing the right things, because subtle little things can make big changes.
Absolutely. Those are 2 excellent points to make. You do want your head to go back a bit, so you allow gravity to pull the head backward. It assists the collar in making the change. And the second thing is how fast you change it. Well, if you're a younger person, most younger people can get down that track, make almost a complete correction very early in the usage of the technology. But older patients, like Dr. Bowen and myself, we have to go a little slower. So we may go halfway up the track, and then a week later, you take another notch back, and each week maybe add a notch there. And maybe if you're an older patient in the 60s, 70s, you're only going to go 2/3 up the track, and that'll be all you need, or halfway up the track. So that's going to be worked out between yourself and your doctor. And we're going to hope that you folks who want this technology, you'll contact people like Dr. Bone, who can feed you to doctors who can help you with this. If you're a younger person and you want to get this thing, you still need to have some referral and oversight from a doctor, but it doesn't require a whole lot of interface. Let's put it that way. And we even might get these out. We're distributing in the military right now, so we just explained how it gets put on the patient and how you're supposed to get the collar on and adjust it properly and then lay back. A lot of the soldiers aren't getting a lot of in-depth explanation. They're doing just fine. Mostly these people are 18, 19, 20, 21. They're younger people. All right, they don't have a lot of advanced disease.
And I don't want to minimize those because they're great people, but I think the dramatic things I see or you've seen is when people come in and they have the pinched nerve, right? And so they have bad nerve pain that goes down the arm. So as the bones are stacked, right, they have these 2 half circles on each side. And as your forward head, they start to narrow that, where the nerve comes out. And so they get this pain down the arm, numbness, tingling, burning. And sometimes in the office, you put the collar on them, they get repositioned and their arm pain just disappears within a couple minutes.
Yes, that happens a lot, but I do want to caution the public out there, because this video is going to be out there for anyone to look at. If you have pain in your neck going down your arm, you ought to have this technology is probably the most ideal technology to be used in conjunction with whatever other therapies your doctor prescribes. But you certainly should be seeing a doctor who's supervising this process. So we don't want anybody out there with pain down their arm trying to treat themselves with this collar. you do have, it is going to help you a lot, but you do need supervision on that. So I'm discouraging you from utilizing this technology if you have arm pain without a doctor's assistance. That said, to the doctors out there now who are watching this video, I would say to you that this is the centerpiece of the cure for neck pain. I'm going to say that again. I believe this is the centerpiece for the cure of the neck pain. You may have to treat disc protrusions and disc herniations, even with surgery or injections. But after whatever therapeutic chemicals are used or surgical interventions, you're going to need to put this collar on the patient afterwards so that they get the proper alignment of the head and neck, and the same process that caused them to get to your office doesn't come back again. This is how you have a good outcome from your medical procedures, and you're going to be successful. Almost all, we have a lot of surgical cases with failed neck syndrome. We put them on the collar and they do fine. So it wasn't so much that the surgery was bad or that the epidural shot was bad. It was that we never got them back in their proper alignment to reduce the mechanical strains that were causing the problem in the first place. So hopefully that makes a lot of sense for both lay folks and the doctors out there. Doctors who need to have more detail should contact myself or Dr. Bowen, and we'll point you to the right information that you need to address whatever clinical situation you have in your office.
Right, and you can see the Cervigard website, so you can go to
Yeah,
that.
Cervigard.com. Just go on there. There's a lot of instructional videos. The research information is on there. It's a pretty good instructional source for both doctors and patients. There's even a doctor training video on there, 15 minutes long, to make it easy for you on your time.
Yeah, if we can only do the right thing, and that is just get everybody to throw their phone away, it'd be perfect, but that's another story.
That's not going to happen.
Right. So let's talk about this gentleman you gave me, we'll put up. So this is a younger gentleman who has the collar on right now. Can you give us a little background about sort of how he came in, what he came in with, and where
Yes,
the
he's a music teacher. He's bent over the students a lot, helping them with their instruments. And he has a pronounced hunch in his upper back, a pronounced forward head posture, a straightening of the neck, and the pinching he's getting in the neck, in the center of his neck, into his shoulders and into his upper thoracic area, upper back on the left side, was debilitating. So he came in quite a bit of pain. We did give him an adjustment, a spinal adjustment as chiropractors, but we put him on the collar right away. And I think within 2 days, his neck pain was about 80, 90% better. This is what we typically see. You still have to treat the underlying cause to the chiropractors out there, the physiatrists out there, and of course, the surgeons or physical therapists out there. You still have to deal with the muscular issues and all the surrounding clinical aspects of forward head posture and loss of neck curve. All I'm saying is whatever your treatment protocol is, when you're done, they need to have the Cervigard to align the head and neck and the cervical lordosis so they heal properly, so you don't have a return of the symptoms.
Right, so we see the picture of this gentleman with the collar on, like you saw earlier, the collar, and then you do some x-rays. Not everybody probably needs x-rays or physicians or whatnot, but can you describe sort of these lines all over the x-rays? A little bit about
Yes. All right, so there's two x-rays you see here. The one on the left, on the viewer's left, is the starting posture of this teacher. And you see that there's just behind the jaw, there's a curved yellow line. That's the normal arc that the cervical curve should have. In other words, that forward curve of the neck that we talked about should be pronounced enough to fit along that arc. On the back of the head, you'll see that there's it's a V-shaped line, and it measures 22.52 millimeters. That's supposed to be in the 60s. Toward the back of the patient, it's from the seventh cervical spinous process, and it goes straight up to the head, and then it goes back to the edge of this. That's it. That should measure 60 to 70 millimeters. It's measuring only 22.52. Now, when we put the collar on him, we put the cheek pads on, we adjust it, it pushed his head back over his shoulders. So let's look at the x-ray on the right. And notice that the neck curve is right on that curve line, that yellow front curve. That's the back one. Let's go to the front curve line first, Dr. Bowen.
Okay, yep.
The front curve line on the cervical spine.
So this one right here.
There you go.
There we go.
Go along that curve. You see how the vertebrae are all fitting nicely, snugly right against that forward curve line? On the first x-ray, there's a big gap. See the gap in there? All right, so the collar is now aligning the cervical curve perfectly. So for the doctors in this audience, the physical therapists who understand the importance of the cervical lordosis, right about now, your mouth should be open saying, wow, what a correction. Now let's look at the head posture too. Dr. Bowen, when you're doing that initially, it should be 60 to 65. And if you go to the at the C7 spinous and go straight up and then back, you see how much bigger that V is compared to the first one. That one's extending 86. Is that 86, that number?
Looks like actually 95.91.
Yeah. So it's going way beyond where we have to, but we're creating a nice stretch so that this will remodel the head neck complex and get that big hump of the top of his shoulders at T1, T2. Look how flat it is there compared to the first X-ray without the Cervigard on. Let's go over there and look at that hump. See the hump there? So you ladies who have that hunchback up there, it's very unsightly. It's part of the problem that you get as a result of forward head posture. So now I've given you another cosmetic vein reason to get your head back over your shoulders. It'll make your posture look better, and you'll look a lot younger for those folks in their 50s, 60s, or even 40s. Any other questions on that?
And I'll throw this up here for everybody too, so you can see.
Yeah, there's the patient. Now, this is the first time he had it on. Now, we would like him to recline back a little more. Right now, he's listening to me go over his x-rays and what we found in his case. But when he starts treatment, I'm going to have him recline back a little bit further.
It's such an interesting case, and we went over what the problem was, what the sort of solutions we have or treatments we have, which unfortunately haven't cured everybody. And now we have a new technology that's been around for a fair amount of time. And the good news, even though it looks a little intimidating, you only have to wear it 20 minutes, pretty much, I say every day, because we're all humans, so we probably miss 1 or 2 days a week, but that's okay. And then within 6 weeks or so, or sometimes we would feel better earlier, but the ligaments and things start to change, remodel, and then this can be a good thing. So we're going to be coming back on our part 2 with Dr. Dellanno. So stay tuned, check all the socials, subscribe to our channel, hit a thumbs up, hit a like button. You know what to do with all these things. It helps our channel, doesn't cost you anything. And then you'll see more content like this. Make some comments below. We'll address the comments, and hopefully, if you're having any problems like this, you can look up Cervigard.com. You can call us at the Jersey Regenerative Institute, call Dr. Dellanno. We can find somebody that's somewhere around the nation that has this technology, knows what to do, can see you, and get you feeling better. So we'll be back next week. Stay tuned.